Hello, I am Dr. Teena Thomas, obstetrician and gynecologist, Bangalore. For converting breech to cephalic position for a normal vaginal delivery, the procedure used in third trimester is external cephalic version. There is another method called internal Podalic version, but it is used basically for the second twin which is coming, which is in breech position. Now, external cephalic position version is actually usually done after 37 weeks. It is manipulation over the tummy to help that such that the breech of the baby goes up and the cephalic comes down to enter into the vagina, now pelvic bone. So basically this procedure is done only after 37 weeks in a hospital, institutional based, and which has high chances of failure and complications also. So the success rate can be anything from 35% to 85%, depends on a lot of factors like for primi or multi, or the first pregnancy, or what is the weight of the baby, how much amount of water is around the baby, how is the pelvic bone. There are so many things attributed to it, and it is definitely a high risk procedure where we done. There are a lot of complications associated with it. Complications can be anything from umbilical cord coming out or cord getting detached. There can be abruption, the placenta can get separate and bleeding can happen. There can be a stillbirth or an intrauterine death. There can be failure of the procedure requiring emergency C-section. There can be a change in the fetal heartbeat. Non-stress test may come a little positive for fetal distress. So these are the many things that can come positive with an external cephalic version. This is a procedure which can be done, but done only when it is really required. Otherwise we don't do, because there are so many procedures complications, and the patient has to be explained about the complication. A written consent is taken before going through this procedure. Now, internal Podalic version is where the obstetrician puts inside the hand into the vagina, into the womb, holds the baby's foot, manipulates and pulls out the baby in a breech position. That is internal Podalic, and that is usually done only when you are looking for a second twin. There is enough space, plenty of liquor, and the baby's weight is less. So in such cases only, because always under anesthesia. This is done under anesthesia because the patient can go into a vasovagal shock. So there are so many things attributed to it. Asking me this question doesn't mean that every single patient who has breech goes and asks their gynecologist to do an external cephalic version. It is entirely the decision of the doctor, because of the extreme high risk complications that are involved. So it is the doctor and the patient combined decision to take whether they want it or not. Otherwise, it is just an explanation of what the question was asked.